As you guys know, I'm Angela. I'm with Young Living, and tonight we are going to be talking about our health share. So I'll pause a couple of times if you have questions. Feel free to take notes. Feel free to take screenshots. And if you want the recording to watch it play back, if you aren't able to take notes on some things, just let me know. I'm happy to send that to you as well. So, about a year ago, Young Living and Clearwater created a partnership to have this health share available to people that is a option that is different but similar to traditional health insurance. So I'm super excited because I've been with Young Living now for 10 years. I'm just celebrating my 10-year anniversary. And this I feel like is a really big thing for people who want to be proactive about their health and have a cost-effective option for healthcare. So let's just jump right in. Clearwater is a healthcare company, so they're a healthcare vendor, and they offer healthcare solutions that are similar to traditional health insurance, but it's called a health share. They were established in 2018, but health shares go way, way back. They've been around for, some of them, decades type of thing. So this isn't traditional health insurance. It is a not nonprofit company. So if you're familiar with nonprofits, what that means is there is a cap or a maximum amount of money or profits that they can have and still keep that classification. If you're also familiar with health insurance, on the flip side, it is all about profits. It's all about making as much money as possible. And that's why healthcare costs are so expensive. So, Young Living created this partnership with Clearwater because they wanted us to be able to have an option to put the control and decisions back in people's hands, and also to help disrupt the health insurance industry as we know it in the United States. And it has been a very good partnership so far. So there's been a bunch of growth between both companies in the last year. So it's pretty cool. As a health share, it is a group of individuals that are pooling money together. So Clearwater pools our monthly premiums together to help pay for the healthcare costs that members have had from month to month. And so, again, it helps to keep prices down because money is actually going back into the bills, the medical bills that those of us have or incur, and there's not a huge sum of money that's being kept for people within the organization to make executives as wealthy as possible or something like that. I came from the healthcare industry, so I saw a lot of things that we could talk forever about, but that's not what this is about tonight. But it's kind of mind blowing the amounts of money that some executives in the healthcare industry make. So, in the health share, we pay a annual max, and I'll get into this in a couple of other screens in a little more detail, but with traditional health insurance, most of us are used to a deductible and then a max out of pocket. So there's two different things. The deductible is the first portion where you are responsible for 100% of your costs, and then your annual max, so the amount between your deductible and your your max out of pocket is usually where you split costs. So maybe your insurance covers 80% of approved things and you cover 20%. That's the most common way that things are split. But with the health share, it's different. You choose one amount once and you cover 100% up to that amount on medical costs. And once that has been met, then pretty much on any of the services, 100% is covered by the health share. So I'll dive into that a little bit more. I have comparisons and things so that you can see those, but it is pretty simple and straightforward. So here's a comparison that I like to show. The health share, again, as I mentioned, it's a nonprofit. Traditional insurance is a for-profit business. And in the health share, a really, really nice thing that a lot of people love. I was just chatting with somebody who couldn't make it tonight that really likes the open network of providers. So there isn't a list, there's not a pre-approved list, anything like that. Any provider that's a licensed provider that we can go to under this care. So like if you need a medical doctor, You can choose any. They don't have a list. You don't have people who have in network or out of network. In network with traditional insurance is a cheaper price or a better price because they have contracts and agreements. Out of network usually costs you more, or pretty much always costs you more with traditional health insurance. This is one price. List whatever provider you want to go to. You don't have to reference a list type of thing. Um, in the health share, claims are rarely denied. And that's because they want to keep us happy and there and paying our monthly premiums so that it's predictable and they can keep costs low. The more people there are paying a premium, and then they're able to study that and they have calculations and all these things that help them to know what the average cost is for people. And obviously, major things can happen, but they usually know approximately how much of that there is, or they're helping people through situations and can predict and know what those costs are going to be like. They're pretty accurate. They haven't had a price increase on premiums in a long time. So it's pretty cool. Um, so again, this really puts our healthcare decisions back into our own hands. So we can go to doctors that we want to or choose anytime, anywhere. This is my family's example. So my family um, switched to this. We had Regence Health Insurance, and we switched to this in September of last year. So I had heard about the partnership that Young Living had at the beginning of last year, so January of 2024. And I kept thinking, this feels like it's too good to be true. And so I never joined any of the webinars or anything to learn about it. And then finally, when I was at our convention in Salt Lake City in July, I was like, okay, I'm going to go to this class. I don't have anything else at this time. I'm just going to listen. And my jaw was on the floor like the whole time. I just sat there like, are you serious? Is this real? Like, are these real life numbers and situations of what people were saving on their premiums, the things that they were getting covered, how much better the coverage was, which again, I'll get into that. But I was just mind blown. So I left in July and I was like, all right, I have to go cancel my insurance, figure out what I got to do. I had to give a 30-day notice and canceled before the end of our annual agreement, or they have like this auto renewal that you have type of thing. So I got it changed as quick as I could. So you can see the prices here. We paid 1,560 for our health insurance, and for the health share we pay 955, and we have better coverage and better visits. So one of the examples I love to do is chiropractic care. We each got 12 visits to the chiropractor per year previously, and now we get 24 visits. And those 24 visits can be chiropractor or acupuncture. So that's a big deal for a lot of people because acupuncture is typically not covered by very many insurance companies. When I was about to give birth to my son, he was overdue, and my chiropractor had recommended that I go to the acupuncture, I think, and my midwife both. I had done massage. Again, massage wasn't covered. I had to pay cash for it. But when I went to acupuncture, I think it was $155, and I went 3 times in a week, maybe even 9 or 10 days, something like that. He ended up being 10 days late. But that's expensive to do those kinds of things. So I really liked that that was covered, and we're saving $600 a month. So it's pretty cool. We did the medical and the holistic coverage, which that shows here. The plan that we have is clear share and holistic, and we're in our 40s. So those are things that we take into consideration, which I'll show you on a future screen when we pull up all the pricing and stuff. So any questions so far before I jump into the 3 types of plans that there are? Oh, you guys are easy. Okay, let's keep going. So there's 3 types of plans, as I mentioned. The clear share is medical coverage. So that is for your major medical situation. So if you have emergencies, if you have a surgery that you need, something like that, that's a hospital type of stay or something pretty large. Holistic is more of your proactive care. So this is for your like regular visits, chiropractic, acupuncture, naturopathic doctor, IV therapy. If that's something that's important to you, you can even get covered on this. Mammograms and you can get mammography or thermography, which we'll talk about in a couple of slides. And so one thing to be aware of is because it's a nonprofit company or business. On the medical side, if you have pre-existing conditions, then you may not be eligible, or those pre-existing conditions may not be covered. So that's something to be aware of. On the holistic side, there are no pre-existing conditions, and this is also great for people that are over the age of 65. So somebody who has Medicare and they maybe don't, I think is it Humana? That's pretty common in the state of Washington for people that are in that age group to get as their supplemental or their add-on. But I've had a few people that don't necessarily like the coverages of that. So instead of that, they get the holistic plan. So they still have their Medicare and then they would get the holistic only. So that's the middle box. The third option is to get both. That's what my family got. So we have medical coverage if we have something major that happens, and then we have the holistic for more of our proactive things that we are doing, um, you know, mostly week to week kind of things. The things that are covered, pretty much everything. Again, remember, there's no network. You can go to any doctor anywhere. This covers accidents, emergency room visits, hospital stays, telemedicine. So you can talk to a doctor 24/7, 365 days a year. One of the things that I like about the telemedicine is that the doctor that you talk to for your original if you appointment or phone call consultation, if you need a follow-up, you're scheduling with that same person. So you're not just calling in and whoever's there or whoever's on call. You schedule with that exact person so they know your situation. They talk to you before. You don't have to re-explain things that are going on. And if it is something that they don't feel like they can help you with, or you do need to see somebody in person, they would tell you that you need to go see a, in-person provider. The $0 mental health sessions, that is not something that's typically offered with health insurance. So that's a nice thing that's available. And I actually have a friend who enrolled in December, and then her sister unexpectedly passed away, young, healthy, in her 40s kind of thing. So she's been dealing with a lot. Obviously, no matter what the age or issue is, you deal with a lot if somebody that's close to you passes. And she told me that she's like, it's been amazing. They've been super helpful, very easy to schedule with, and just a very easy process. Care coordination. This is a department within Clearwater that helps you if you have something major coming up. So, like, let's say you need a hip or knee replacement surgery. There was a gentleman who did have this, and he worked with the care coordination department. So, his doctor had or was going to do the replacement surgery at a hospital where the cost was quoted at $80,000. Care coordination got involved, helped, did a little bit of research, and discovered that this same doctor does surgeries at a surgery center. There's a lot of benefits to surgery center. Number one, they're more cost effective. Number two, less risk of infection at those. There's a lot of studies on that. I used to work in surgery, so I'm very familiar with it. And so of course he chose to do that instead. It was $40,000 at the surgery center, so half the price. And because he did that and saved the organization as a whole a lot of money, he didn't actually have to pay his annual max for that service. So it was waived. And so it saved him that $5,000 that he normally would have had to pay out of pocket. So huge benefit to that department that helps us as individuals save money and the organization as a whole to keep costs down. You can see the list. If you are on a device, you want to take a screenshot, you definitely can. So of this, so you can look at it or reference it later. But pregnancy, postpartum, anywhere you're giving birth, hospital, birth center, home birth, home health care, pain management injections, hormone therapy injections, medical supplies, nutritionist services, international medical treatment. That's a big one. So again, almost never covered on traditional health insurance that I've ever heard of. If you travel outside of the United States, oops, somebody's in the waiting room. Excuse me. I want to let them in. So if you ever travel outside of the United States, your health insurance doesn't go with you. You need to buy travel insurance. This does. You could go to a facility, hospital, wherever you need to go, get a receipt, you pay for it, you get a receipt, and then you would get reimbursed according to whatever the service was that you had or needed. So that's huge for anybody who travels to not have to buy that extra thing. occupational therapy, physical therapy, speech therapy, massage therapy, in and outpatient hyperbaric therapy, durable medical equipment, skilled nursing facilities, hospice care, and weight reduction. So again, almost anything is pretty much covered. So really nice benefit and a long list there. This is the holistic services. So the specific, like I talked, there's the clear share that you can do individually, which is medical. You can do the holistic option, which covers these services. So under the holistic, well, the first thing that's listed there, I absolutely love, is that it's about being proactive about your health. So if you're an individual, you can get reimbursed $50 a month for Young Living essential oils or supplements. So this is a big part of the reason for the partnership. If you're a couple or a family, and that's the policy that you get, then it's $75 a month. So for my family, we've always been buying our supplements and our oils from Young Living, like I said, for 10 years. And now we get reimbursed for $75 of it per month. And that obviously was never the case with health insurance. Health insurance is sick care, not about being proactive about your health. Primary care visits, a nice thing, again, that a lot of traditional insurances don't have is naturopathic doctors being covered. They're covered the same as an MD, a doctor of osteopathic medicine. Any of those fall within that category. Internal medicine doctor, whoever it is, they all fall within under that category, and you can go see them pretty easily. So, breast imaging, again, once a year. This again gives you the choice of thermography versus mammography. So for myself, I prefer to not do mammography to have that radiation exposure. So I was doing thermography before when I had traditional health insurance, paid 100% out of pocket for it. So this is nice that it's now covered up to $150 a year for going to get that. And again, it's your choice. You can do either one. The next field is showing category of chiropractic and acupuncture. And again, there's two holistic plans that we'll talk about in a minute. But with the full holistic plan, you get 24 visits, and it's your choice. You could go 23 times to the chiropractor and one to the acupuncture, or vice versa. Any mixture, you go all to the chiropractor type of thing. One of the things that I love about this, that is such a big deal, is that it's $175 reimbursed per visit. Huge thing, because now if you think about it, chiropractors typically are between $40 and $60 if you're just going for an adjustment. So, if you're already an established patient, you don't need x-rays or something like that. So you're like, well, why would I need 175? It includes add-ons. So if your chiropractor offers massage therapy, if they offer red light treatments, if they offer supplements, any of your add-ons at that visit on the same receipt are covered. So you would pay for it and you'd get reimbursed everything after the $35. This is huge. We have an electrolyte supplement that isn't offered from Young Living, but my chiropractor has it. So when we go, I buy a big box of it, and it's like $45, I think. And so I buy that as an add-on, and I'm able to get that. And I actually just found an acupuncturist that I really like that offers massage. So I'm going to go get my acupuncture and massage as an add-on and be able to bill that as one visit and get those benefits. So love, love, love that, because it's a great way to get massage covered by the healthcare. And then IV drips, once a month, $100 benefit on that. And then prescriptions. So generic prescriptions covered at 100%, and name brand quoted upon whatever the cost is. Obviously, there's thousands of them, and so the cost depends on the specifics of that one. On the holistic side, I want to make sure that I explain this as well, and it's really clear, is when you go to any of these providers or get any of these services that are listed, you pay for them as a cash patient. So if you were going to the chiropractor, you'd pay for it. You get a receipt, again, making sure that your chiropractic visit and any of your add-ons are on the same receipt so that they count towards that $175. You submit it. It only takes like 2 or 3 minutes. Super simple. And then you get reimbursed. So for chiropractor, you are responsible for $35, as you can see in that middle column, and then they pay up to $175. So your visit could be $210 and you get reimbursed $175 of it. Again, totally unheard of with health insurance. So I love that. And I want to pause here. So if anybody has any questions on the holistic side, or how that reimbursement or anything works, I can share that with you or answer those. Nothing? Okay, you guys are easy. Holistic savings. So this is a more basic option. We're finding, like, after about 8 or 9 months last year, there were people asking for something more basic. They're like, I don't feel like I'm going to use all those services. So we created an additional option that's called the holistic savings. So you still get the essential oils and supplement reimbursement. There's primary care included, and for the chiropractic and acupuncture, it's only 12 visits a year, and it does not include the medications. It does not include the IV drip, it's the other one that I'm missing. Let me go back to the last screen. Breast imaging. I always forget that one. So those are the differences in those two plans, and we'll pull up the pricing comparison on those in just a couple of minutes. So this first one that I'm pulling up the pricing on is the medical only. So you can see there in the top left, it says clear share. So this is for medical only. One of the benefits, again, another benefit to having this is that for people who are younger, it's significant savings compared to health insurance. If you're in like your 40s, 50s, 60s, that type of thing, then it's not going to be as significant. I had one person that I could only save her $40 a month, but she had a better coverages, and her out-of-pocket costs were also pretty significant. So those, I like to just share that and be upfront, because obviously the older we get, the more likely we are to have health related situations, where the younger people are less likely. So on this, what you're going to look at, that yellow part across the top, is what is your comfort level for your annual max. So on the medical expenses, what are you comfortable with being responsible for the first portion? Is it $1,000, 2,500, or 5,000? And then you look under the age categories. There's a section 18 to 29. And within that category, are you a single person? Are you married? And this is who you're looking for coverage. You don't have to have coverage for everybody in your household. If it's only you and you have a spouse and kids, you don't have to have coverage for them. So this is who is in your household that you're looking to have coverage for. And then it goes down by the age groups. And then you look within the columns of which annual max you're comfortable with. So I'll give you a moment on each of these screens as we're pulling these up for you to take a screenshot or zoom in if you want or need to. And again, let me know. I can send you the recording so you can pause and reference back to it if you want to and compare them. All right. So the next one here is for somebody who wants holistic only. So again, if you have pre-existing conditions, if you are Medicare age, or some people actually have a couple of people who have great health insurance, but really high deductibles, doesn't like to cover the medical side, doesn't cover holistic things. And so they will still get this. Like, for example, one is military, and so he's covered, he has that, and he's like, I don't want to go there for every little thing. So he wants to be able to go to his chiropractor that's close to him and not have to drive a half hour. He wants to be able to go to a naturopathic doctor, those kinds of things. So there are other situations where people have the medical side covered and they still want something like this. So again, this one it's not based off of age, because it's very clear and cut, dry, how many visits it covers, what it covers, that kind of thing. So a single person, married person, cohabitating, a single with kids, or family are the three categories here for the monthly premiums. Here is, and now we're moving into the combination. So this one is the holistic savings with the medical coverage, which is the clear share. So this is the more basic. Holistic savings is where you have the 12 chiropractic visits in the year, chiropractic or acupuncture, and that. So the more basic. Again, same thing on whatever you're comfortable with, the medical annual max being, you look in that column based off of your age and the people that you're looking to have coverage for in your family. If there's anybody that wants to shout out, if they can't see, because again, I know it's small print, I can always share what the costs are in any of the categories. Okay, this screen is For the full holistic plan, so holistic and medical, which is the clear share coverage. I'll give you a second if you want to take a screenshot or unmute or ask questions or zoom in, whatever you need on that. Okay. And I also like to explain the annual max. It's really straightforward if you're an individual. The annual max is 1,000. The one thing that it's interesting on the $2,500 tier, an individual only is actually just 2,000, and then on the 5,000, it's 5,000. And coming soon, we will have a $10,000 annual max option for somebody, again, somebody who's healthy, maybe has a big savings account, and wants their monthly premiums even lower. So that's something that's coming later this year. But on the annual max for a family. I want to specifically point that out. Like I said, for myself, or I showed on that screen, we did the 2,500 tier, and we're a family of four. So if each of us had a annual max of 2,500, that would be 10,000. But it caps and doesn't just keep increasing. So for my family, our annual max as a group of four is 7,500. So if you or someone you know is a large family, this is a really good thing because, again, compared to traditional insurance, there are max amounts for each individual. So if it's a family of five, six, seven, eight, it's going to be significantly high, $20,000, $30,000 if something major happens to them, where this is not going to be the case here. So really, really good for the larger a family is on those situations. Any questions here? You guys are amazing. I'm used to questions, but I like to keep it to 30 minutes as well. So I got 2 minutes left. On the vision and dental side, this is something that you can get as an add-on. You can get them as individual services, or you can do a combination of the two. So for my family, we did this vision coverage, and we stayed with our old dental coverage because the orthodontic coverage was better on our old one, and it was within like $5 a month of the premium amounts, so they were almost the same. So that's what I chose for my family, just because I have little ones, and I expect that my daughter is going to need braces. So wanted to make sure we were covered there. So how does this work? The plan, again, like I mentioned in the beginning, it's a partnership with Young Living, which is my company. And so first thing you do if you're not already a customer with Young Living is you'd become a customer with Young Living. And then we have a special link that would allow you to then set up your plan with Clearwater. The monthly premium is paid to Clearwater. Reimbursements come from Clearwater. The website where I was talking about how you upload receipts for anything holistic related is on a Clearwater website, and it's super simple, super easy. And they have, again, like it's the portal is what that's called, and it's really easy to do that stuff. You'd purchase, if you did the holistic thing side of things, you would purchase your essential oils and your supplements from Young Living for that specific reimbursement, but you get the reimbursement from Clearwater. So again, it's all about that partnership. The way that it works and timing of it is when you sign up for a plan, you can do that anytime throughout the month, and you're signing up or enrolling for coverage to start on the first of the following month. So if you sign up between today and Friday, your coverage would start on Saturday, and your first premium would be due on the 10th of the month. So it would be due on March 10th. And you could start going to the doctor or getting coverages and collecting receipts as of the first, and submit those as soon as your ID is set up. It all comes to you in email and makes it really easy. You also get physical cards. That usually takes about 3 to 4 weeks.